Good day. I am Dr.K Gireesh, physician, neurophysician and neurosurgeon. On behalf of Padma Clinic and Nursing Home, Chennai, as a part of the continuing medical education program, as well as a health awareness program for the general public, the topic which I am going to highlight today is on facets of epilepsy, that is the multiple facets of epilepsy. And one such is, epilepsy person, can they swim? This is a common question that has been asked especially by certain people suffering with epilepsy. Can I go for swimming? Now, it is a very important question and one has to understand that swimming can be permitted, provided of course certain safety precautions have got to be there. Again, I emphasize and re-emphasize as well as reinforce the thought that 1. Take the medicines regularly, number 1. 2. Take the food at the appropriate time. 3. Sleep for 6 to 8 hours, very important. And above all, certain safety precautions you should observe when you go for swimming, which has been detailed by the International League Against Epilepsy. That is 1. Swim in a pool which is not an open water like a sea or river, in an enclosed pool. Tell the lifeguard if it is available, or you have to have a person who knows swimming to be with you. When you go to the pool, inform the lifeguard in advance that you have a problem like this, but it is well under control. And especially try to swim on the shallow side as well as on the outside of the pool. Actually, outside means on the outside lanes of that particular pool, and visit the swimming pool at a very quieter time when there are not much of people around, so that the lifeguard can in fact concentrate on you. And if you are too tired, do not go into the pool. Consider having some sort of a drink, that means some nutritious drink before you go in for your swimming, because that will not because itself is an isotonic exercise and can reduce your blood sugar and you can end into dehydration. The other very important thing is, when you suddenly dip yourself down into the pool and you hold your breath, you have to be very careful. Don't be for too long beneath the or inside the pool with your head beneath the water, because that if the oxygen is not sufficient enough, it can trigger a seizure. Therefore, one has got to be very, very careful. Try not to get too tired, as this can trigger a seizure, and consider having a small drink, or you can say like a nutritious drink, before going into for the swimming. The lifeguard, in case something arises and one fit occurs, the lifeguard in fact should gently support your head so that it is above the water, very important, otherwise you can get aspiration. Guide you to the shallow area and not to restrain any movement, and then slowly take you on to and see whether you have swallowed or not, then accordingly it has got to be done. Otherwise, ideally nothing should happen, because these are some of the precautions which you have got to take, but the most important thing is you should get the advice from your family doctor and especially the neurologist. Only in consultation with your neurologist should you go ahead for swimming. And when you go for swimming, see that you take the medicines very regularly, fits are well under control, and you are taking your food at the appropriate time, as well as you should sleep 6 to 8 hours every day. With all these things, there are no trigger factors, well under control. Inform the lifeguard, or you take a person who knows swimming to be with you in the pool. These are the safety precautions as even pointed out by the International League Against Epilepsy for those of you who in fact want to swim. So that is the answer. Can I go for swimming? Can my son go for swimming? Can my daughter go for swimming? It's for answer for those parents who have children with epilepsy. Well, that's it. Thank you very much.